Thank you for joining me for this talk about the design and protocol for an interrupted time series and synthetic control study to evaluate psychiatric decision units in acute care pathways. My name is Dr. Lucy Goldsmith. We will be doing a 360 degrees evaluation as shown by the animated tree. There is pressure on acute mental health care internationally. Consequently, there has been a focus in policy and guidance to improve acute crisis care pathways. A range of new services have emerged, including psychiatric decision units. The expectations for what these new services deliver are high, but there has been little evaluation of the effectiveness of these services. A mental health decision unit aims to reduce short-stay informal psychiatric admissions, reduce mental health presentations and long waits at the emergency department, and improve the experience of support in a crisis. They're small, nurse-led units with a high staff-to-patient ratio. Our aim is to examine the effect of this service on the mental health crisis care pathway over a 4-year time period using rigorous non-trial methods. To maximise generalisability, we have chosen sites with variation in the configuration of the PDUs to allow for comparisons and to ascertain the optimal PDU configuration. As we can see on this slide, there are 4 sites, 3 located within a city and 1 in a rural setting. The maximum length of stay ranged from 24 to 72 hours. All accept referrals from liaison psychiatry within the emergency department, and some units accept referrals from a range of other sources, including crisis resolution and home treatment teams, street triage, and the 136 place of safety. Our primary outcomes are, for acute trusts, the rate of ED psychiatric presentations, and for mental health trusts, the rate of voluntary admissions to mental health wards. In these analyses, outcome data will be collated as a time series for 24 months pre and 24 months post implementation of the PDU. We will use segmented regression analysis of interrupted time series data for the ITS. As shown here, we identify changes to the level or number and slope or rate between the periods preceding and following the launch of the PDU. This approach minimises threats to internal validity while maximising external validity by taking into account any serial correlation, background variation, and underlying trends independent of the intervention over time. In the generalised synthetic control method, the computer generates a comparison group by matching the data series for the 2 years preceding the introduction of the decision unit to trends in other trusts. The synthetic control is not identical to any one trust. It could be, for example, a linear combination of different sites, e.g. composed of 20% from Glasgow, 70% from Hull and 10% from Bristol. In a synthetic control study, the comparison is therefore between the trust under study and the computer-generated synthetic control. This automatically controls for changes in national trends and policy over the period studied. This will be the first formal evaluation of psychiatric decision units in England. The analysis will provide estimates of the effects of the decision units on a number of important service use indicators as secondary analysis, providing much needed information for those designing service pathways. Our research has been designed and will be carried out with the involvement of service users and carers. Please read our published protocol for more information. You can see the citation on the bottom of the screen. You can also email me, add a comment below to the video, and follow us on Twitter and use our website. Thank you for listening.